In this edition of Ask the Doc, I got a question on what causes trap muscles to always be so tight and develop tension knots. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. Back at it for Ask the Doc. Just a quick reminder, you can send in any questions you have on neck, shoulder, elbow, or wrist injuries and pain directly to me. And if it's a good question, I will cover it on an episode for you. So this week's question was, it seems like my trap muscles are always sore and in pain. As soon as I wake up in the morning, they feel like they are locked up and always so tight. I can stretch them out, but that only helps for a few minutes. I have done the deepest of deep tissue massages, roll on a foam roller and lacrosse ball, get my neck adjusted every 2 weeks. I even have my husband squeeze really hard on the knots in my traps, all of which helps me feel better for no longer than a day. It used to be annoying. Now I've gotten to the point where it just hurts all the time. It takes away all my attention and focus. Why are they always so tight? Why do I keep getting knots? Why doesn't any of those treatments provide any long lasting relief? So let's start with three common causes of the feeling of tight traps that most providers completely miss. They usually start to form in this order. Number one is going to be scar tissue formation in the muscles. It's that giant knot that you feel in there. So a lot of people reach out to me and ask me questions. They're like, how in the heck did I get scar tissue? I don't have an actual injury. It's always a really good question. So you can get scar tissue in two ways. One, you could just have an injury and an accident and the muscle tears and it fills in with scar tissue. That's like 10 or 15% of the time. The other percentage of the time is just from bad posture, overuse, stress, not moving enough, maybe watching and looking down at your phone. If you're doing that right now, you're adding scar tissue into your neck. So what happens over time is the muscles are just constantly stretched and contracted. They don't get enough blood flow, they don't get enough oxygen. And then what happens is it sends a signal up to the brain, and the brain goes, hey, there's something going on here. So I need to help out. So what it does is pumps out all these fibers and cells. They're called collagen fibers, but they didn't have enough time to cook them fully. So they're kind of like half level collagen stuff, and it starts to build up in the muscle. Over time it gets bigger and bigger, and what it does is it causes that muscle to get weaker, less flexible, and less blood flow, and that builds up in the muscles. Then the second problem that happens is the nerve, especially in the back of the neck. It comes out right behind your ear here, and it sits right on top of your trap. It's called your spinal accessory nerve. Its job is really to control your trap muscles and this big muscle in here in the front of your neck called your SCM. Now, what happens is nerves are built with about 15% of extra slack to keep them healthy, kind of like a rubber band. So over time, what happens is that scar tissue gets bigger and bigger, and then eventually it just gets stuck to the nerve. And when it gets stuck to the nerve, it presents with things like numbness, aching, burning, and tension. And when that nerve gets stuck, everything around there just tightens up because the body's number one priority is actually to protect the nervous system. Because if your nerves don't work, you don't work. So a lot of times people will get extra tension in their traps because that nerve is there. Their shoulder might roll forward. They might go up like this. They might be in a bad posture all across the board because that nerve entrapment is occurring. And the last problem is now the muscles and the nerves don't work correctly. The muscles can't do their job. They can't provide force and stability and overall strength to the spine and to the joint and to the disc. The nerves can't work correctly as well. So the force has to go somewhere. And where it ends up going is on the joints and the discs in the neck and puts a lot of pressure in there and can create these things called pain referrals. They're also known as sclerotomes. And you can see in the photo that it kind of radiates down there. So a lot of people that think that they have a trap problem, a lot of times it's because the neck is really getting beat up. And when the neck gets beat up, it sends signals out to different areas. So those are the three most common causes of it. First, it starts with the scar tissue, then the nerves get caught, then the nerves and muscles are caught, puts more pressure on the joint. This is why this is getting progressively worse. So once those nerves put pressure on the discs and the muscles, they really get angry. And a lot of times it's going to be more of like a sharp, deep pain, more annoying. A lot of time that pain is going to be a lot worse when you first get up in the morning, a little better as the day goes on, but then gets sore again. Or if you spend too much sitting down, too much time sitting down, it can put you in a bad spot as well. So why is stretching, lacrosse balls, deep tissue massages, and the husband squeezing really hard not helping? Basically, what's happening is you're just creating a change, a temporary change in the tissue. So when you go in there and squeeze on that area, maybe you get a deep tissue massage, maybe you roll on the lacrosse ball. What it does is it stimulates these special type of fibers in your muscles. They're called mechanoreceptors. They basically just sense like vibration in movement, and then it travels up your spinal cord. In your spinal cord, there's another pathway that also handles what's called pain. These fibers are called nociceptors, and they sense pain. So when you're doing the massage, you're doing the lacrosse ball, you're getting your muscle squeezed, what happens is it stimulates those receptors and they kind of go firing and start going a little bit crazy. And it blocks some of that pain and you temporarily feel better. The best example I can give of this is like when you jam your thumb in a door, kind of shake it out to take some of that pressure off of there. That's what's going on, but it's not actually fixing any of the problem in there. This is why it's not long lasting. It's not actually a treatment because it's not getting rid of any of the scar tissue, not getting rid of the nerve entrapment. And lastly, not taking any pressure off of the discs. Now, the adjustments, why they don't work and make it worse. Um, I have my degree in chiropractic. I don't do any adjustments. I've been in practice for 14 years. I specifically only focus on the soft tissue. So what happens is with the adjustment, the bone goes out of place, they put it back in place, but if you don't fix the soft tissue, it's not going to get any better. So that's what's happening. It's the same thing. They stimulate some stuff, it temporarily feels better, but it's not getting to the root cause of what's going on, which is the nerve entrapment and also the scar tissue formation in the muscles as well. How would I go about fixing this in one of our peak method certified clinics? Number one is we always start with a thorough and detailed history about what's going on and really figuring out where the problem is. Because if we don't know what it is in the first place, we can't fix it. Then we'll go into a detailed functional evaluation with really focused palpation to know exactly where those nerve entrapments are, where that scar tissue is forming, so we know exactly where it is. Then once we isolate where that problem is, we use a hands-on manual therapy that goes in and gets proper depth, then tension, and has the client go through a full range of motion as we hold pressure and break down that nerve entrapment. I'm going to include a video of me treating an accessory nerve entrapment as well this week so you can see what it looks like.
Thumb is backed up, and like that, your depth is in straight in just like that. Elbow drops, and you're going to drop in and let it come right to you, and go ahead, go nice and slow. And essentially, as we go in there, it's going to get caught right in between there. And when it's bad, you're going to feel some of that superficial tension, and that's that accessory nerve because it comes out behind the ear, comes on through here, and where it gets stuck is right there. Get that depth by leaning in, and this one, little less depth come out, and then your tension is going to be that slow drop. You're going to go. You're going to feel that nerve pull. And when that nerve is bad, it'll pull right away.
You can see in the video, it's very focused, it's very precise. A lot of providers, when they go in and treat these nerve entrapments, they're way too compressive. They just push on it. It hurts like hell, and you think they're doing something, but they're really not. So after we remove the nerve entrapment, we have to get rid of that first, because if we don't fix the nerve entrapment in the first place, nothing else is going to be better. Then we're going to treat all the scar tissue in and around the neck to increase range of motion and get some of that bad tissue out of there and increase some strength. Once we do that, we build up some strength in the muscles around the neck, the mid back to help hold better posture and stability. A lot of times the muscles in the front of the neck get very weak. Just from overuse and a lot of those other muscles not working correctly back there. Your neck has a core just like in your gut and your abdomen. So we got to get these muscles strong as well. And lastly, we have anyone that's getting adjusted, just stop getting adjusted because it's not getting to the root cause of the problem. And a lot of times it's actually making the problem a heck of a lot worse. So that's all I got for you guys on this video. If you've been dealing with tight traps and never ending knots for, I'd say, at least 6 months, you've seen lots of other providers and you've gotten zero pain relief or improvement in function, and actually maybe it's gotten a lot worse, then you can reach out directly to us and get set up with a peak method trained provider to get some real answers and get on the path to functioning and feeling a heck of a lot better. All the information to do that can be found directly on our website. I appreciate you guys watching, and I will see you on the next one. Bye.